Welcome to Tame the Taboo. This podcast is brought to you by Discover Health. Discover Health specializes in healthcare, education, and resources for her most intimate concerns. I'm your host, Nurse Ray. I'm a women's health and gender-related nurse practitioner, and I am making it my business to take you from sufferer to sensei. So if you are suffering from conditions that are not easily treated in an annual exam, or you want to join me on this journey to become my healthiest, wealthiest, best business owning self, sit back, relax, and enjoy these episodes. All right. Welcome back to Tame the Taboo. So this is the podcast where we talk about all the taboo subjects, including sex and money and everything that people like to shy away from. I'm your host, Nurse Ray, and today we have a very special guest. She is also a fellow nurse practitioner, a fellow fighting Quaker and Penn grad. And we worked side by side at GW for a few years, and she's a sexual medicine specialist and one of my good friends. So I'm so happy to bring Emily Odenwald to Tame the Taboo. Welcome, Emily.
Thank you. I'm so happy to be here.
Yes. Okay. So I gave you that brief little introduction, but what do the girls need to know about you? Like, who is Emily? What's your story?
Oh, geez. I grew up in the DC area, and so this is my home. I like taking care of patients in my own community. I started out as a surgical ICU nurse up at University of Maryland and did that for a little while. And the whole time kind of had a plan that I wanted to be a women's health nurse practitioner, but most other nurses who were going on to graduate education were doing CRNA or acute care. And so when I brought that up, I didn't know any women's health nurse practitioners. And when I brought it up with people at work, they were super supportive, but also were like, what is that? I think, probably not dissimilar to a lot of the patients that I see now, had some pretty negative experiences with my own being a patient and seeking out women's health care, when I was in college and, immediately after college. And, just kind of left with this question, like, why does it need to be like this? Like, this is really, it just seemed very unnecessary and preventable. And so I kind of had this bug in my head where I said, I kind of want to do something about that. I want to make that different. And so went on and became a nurse practitioner and then practiced out in Baltimore City at Planned Parenthood for a couple of years, which is amazing. Most amazing team there. And then moved back to DC to be closer to home and started with the minimally invasive GYN surgery team at GW, which was an amazing experience. And then for the last, probably a year and a half now, maybe even a little bit longer, I've been training with Dr. Sarah Stigma, who's the most incredible mentor. And it's worked out really serendipitously, and I take care of the most amazing patients and work with the most amazing team right now. And it's really exciting. And it almost kind of feels like it's starting to fall into place and come full circle now, that I'm able to, make an impact and provide a safe space for patients that, may not have necessarily felt safe in other places.
Yeah, and safety is because if a client or a patient doesn't feel safe, then they won't be honest about the full story. So it means that that's definitely going to impact their care. And safety should be our priority 100% of the time. So yay.
Yeah.
Well, so we worked together at GW. At that time, you said you were working in MIGS, which is minimally invasive surgery or gyne surgery. So seeing a lot of the endometriosis patients, and I was in the urology clinic, so seeing those same patients, but for different reasons. So doing more of the sexual health and the overactive bladder incontinence kind of work. And so we've kind of been counterparts for a long time now, seeing these same patients because everything is so interdisciplinary. So even though we have the same degree, graduated from the same school, we are coming at it from different approaches, but again, providing care for the same people. So that's awesome.
Yes. Yeah. We share a lot of patients even still.
Even still. Yeah. So, okay. A lot of nurse practitioners come into the work, especially women's health nurse practitioners, like, all right, I'm going to go and do GYN care. Tell me a little bit more about like how you found your way into the subspecialty.
Yeah, I mean, I think we were lucky, in our program in that I left our program knowing what ISWISH was. I didn't know necessarily what to do if I had a patient coming in who was reporting pain in their vestibule, but I knew that, there's this place that you can go and there's this tool they have called Find a Provider. And I think this is where you need to go. And that it wasn't enough. And I've had to kind of learn so much since graduation in order to take care of people the way that I do now. But that's already more than a lot of other people get, is just knowing what ISWISH is and knowing, just knowing that maybe just asking about someone's sexual history beyond just have you been exposed to an STI, asking, like, are you happy with your sex life? Are you having pain with intercourse? Are you like, how's desire? Have you noticed any changes? Do you have concerns about your sexual health? That's really as important as asking about other things. That was kind of baked into our education, I think, more so than maybe some other programs or, just through conversations I've had with people who've gone through other programs. And for that, I'm so grateful. I think that's kind of where it started. And then, I took care of so many patients while working first at Planned Parenthood and then certainly with MIGS, who, again, I could recognize that there were issues that I didn't know enough about. And I was very fortunate, especially once I got to GW, that Dr. Sarah Signa was there. And she was so, passionate about teaching and mentoring. And so I think it was more so I could recognize there was so much that I didn't know, and that is frustrating to me. I have to know the why. I think just the nature of the work I was doing, it came up, and knowing how important that was to ask. I credit our teachers, frankly, in graduate school. I think they were very aware of how important this work is.
Definitely. You don't get to be a school of nursing in the world offering your students the right resources. So shout out to University of Pennsylvania. Through and through, I'm a proud Quaker and so proud of the work that we are able to continue to do as healthcare providers, and just knowing again that you don't have to be boxed in. You can think outside of the box. You can use the skills that you have to treat the patients and feel confident to ask these questions, because that's really what it is a lot of providers don't feel confident that they have the tools to be able to treat these things. So then it shuts down the conversation before it's even able to get started. So all right. So you are back home in DC, and now you're working with Dr. Signa at Saga. So let's rewind it a little bit. So ISWISH, which you brought up, is the International Society for the Study of Women's Sexual Health. And we are both members there along with Dr. Sarah Signa. And like I said, we all worked at GW and kind of we're working in silos doing the sexual medicine work from different departments. But now tell us a little bit about what is happening at GW.
Yeah. So we have now an amazing resource for patients, which is the Saga Center, or the Sexual Health and Gender Affirmation Center. And there's myself and 3 other physicians who are incredible. And we are now able to offer these services to patients in more of a formalized way. Like you were saying, like it's been there, but now it's more of a formalized center, and we're so excited. And I mean, it's just, there's been so much support, and like clearly, I mean, people recognize there's such a need. And we're just so grateful. I'm so grateful that I'm able to be a part of it, because it's, I think, a really unique place. So we still offer like full scope OBGYN as well, but most of us, 3 of us, have more of a focus on sexual health, and then another one of our physicians offers gender affirming care.
That's awesome. So there are practitioners out there that are considering maybe a career change or starting out their career. And do you have any advice for them if they are seeking to be able to care for women who have pelvic pain and vulvovaginal disorders?
Join ISWISH. That's the best advice I can give is join ISWISH. ISWISH has so many available opportunities for self-teaching. I think I'm so fortunate in that I had a mentor who I was working with on a regular basis in person. And I recognize that's just not going to be available for a lot of us, depending on where we live and where we work. And I think that's been really important for me. But also, even prior to coming to GW, I had already attended an ISWISH annual conference, and I had already gone through some of their modules, and it's so helpful if you've never been exposed to this information before. I think what's so unique about ISWISH and why I've felt so at home in this community is that it is incredibly interdisciplinary. You go to annual conference, there's physical therapists, there's sex therapists, there's psychotherapists, nurse practitioners, PAs, physicians, and everyone is welcome, and they make that very clear. And that's not always the case for some nurse practitioners when they go to these big conferences. So they are so eager to teach you, and there's so much information that you can absorb on your own time at home through online modules. The in-person conferences are incredible, but you're not able to go. There's just the gamut is available. It's all there. It's just a matter of joining and absorbing that information.
And there's just also just a great community, right? So we do networking events. Patient advocates are encouraged to join ISWISH. And so it's not just clinical providers. There are also, clients or former clients who are writing books and doing all these wonderful things to really create a full circle moment for women's wellness. And so I am a big fan of ISWISH, have been a member myself, and encourage everyone who is interested in doing this sort of interdisciplinary work to definitely join. So you're doing Saga, you are busy establishing the center over at GW, you are delivering care for women who have pelvic pain. What is on the horizon? Like, what are you kind of thinking about, like, now that you've mastered, okay, I can care for women who have pelvic pain? Like, we always have that next thing. Like, what's that next thing for you, do you think?
I still feel like I have so much to learn. The field of sexual medicine is so new relative to some other subspecialties within OBGYN. And, while that can be frustrating at certain times in that, it's just like, why hasn't this been studied before? Like, it's not that women have not had these problems for, a long, long time. We're still kind of catching up. But there's just the amount of information that's been generated is overwhelming, especially for someone who's relatively new to this field. So I still feel like I have so much that I want to learn. I think disseminating this information to other nurse practitioners is becoming more and more of a main goal of mine. Folks across disciplines need to know about the conditions that we treat and recognize that they're not as rare as they may think, and know, if not what to do about it, who to refer to. I think especially for nurse practitioners, so many of us are in spaces and seeing patients where, it's incredibly appropriate for us to be asking questions about sexual health. We're seeing patients for primary care, for preventative care. Obviously, what we're doing is, more like gynecology. But I think regardless of what specialty you're in, there is a space for asking these questions and knowing where to send patients, and making that more of a standard in terms of education, in terms of, I think I hope that in the next 5 to 10 years, in the same way that, hopefully medical education and residencies, this is becoming more of a part of their curriculum. I hope that we can also make it part of curriculum for nurse practitioners, and not just women's health nurse practitioners, but nurse practitioners across different disciplines. That's something that when I teach medical students, regardless of what specialty that they're hoping to land in, I always try to make it applicable what we're doing in sexual health clinic. Even if you want to do radiology, here's where I think you could make this applicable. Or if you want to do pediatrics, or if you want to do emergency medicine, like there's always a way to bake this into their education and to make it applicable for them. And I think we can do the same thing for nurse practitioners.
Yeah, not only can we,
Yeah.
I was a professor at Georgetown, and that's really my goal right now too, is to figure out how we train an army, because I talk a lot about this revolution, this women's healthcare revolution, and revolutionizing the way that we deliver care. And it can't just be Emily and Jenna and these few other nurse practitioners and physicians that are doing this work. It really has to be a swell of providers who are armed with this information to be able to have that confidence to really deliver the care that women deserve. So
Absolutely.
I'm excited to continue to work side by side with you and continue to teach the next generation of leaders in our field. It's going to be amazing. I'm looking forward to the growth. And this
I am. Yes. There's a lot of work to be done. There's so much work to be done, but I think that's another really unique thing about the space that we are in within sexual medicine, and why I would encourage other nurse practitioners to start looking into this. Is it really is so exciting to be. It feels like we're at the start of something, and like I said before, like on the one hand, that's frustrating if you look at it through one lens, because it's just like, people with vulvas have had these problems for so long. Like, why are we just now getting around to this? But on the other hand, being within that energy and, seeing patient advocates do the most incredible work to get the word out, and just watching the impact happen and like unfold in front of you this is so important. This is essential healthcare. It's really nothing different than, going in for a pap smear. This needs to be just normalized and destigmatized. And I feel like it's starting to happen, but there's so much work that needs to be done. So I'm excited to be a part of it, hopefully.
Definitely. One thing that I'm proud of us for just the work that we're doing today and in this moment is nurse practitioners, we have to put our voices out there. We have to put our faces out there. We cannot let our MD counterparts or the patient advocates be the only people who are kind of voicing the concerns of women. We are in the thick of it. We are on average spending more time with clients. We're seeing the same amount of clients. We're doing the same work as our MD counterparts. So we must also be visible when it comes to putting our stories out there and putting our patient stories out there. So I know that it was not easy for you to sign up to be on a podcast, but the work is super important, and I'm so proud of you for showing up today.
Yeah. No, I think it really is. I think it is our responsibility. It's part of the work that we do, this is part of the holistic care that nurse practitioners take pride in delivering, is, taking care of the whole person, and that has to include advocacy. And for those of us who this doesn't necessarily come naturally, myself included, I think it's just, it's I think just reframing it and recognizing that that this is part of taking care of the whole person.
Yeah. Okay, so there are nurse practitioners that are out in the world who are like, what's my next step? So they're going to join ISHWISH. They're going to, follow us. They're going to listen to this podcast. They're going to start to apply some of the things, like simply just asking about sexual health in their clinic. We're going to, stay committed to being a part of the research and delivering the advocacy that we know needs to be done. Any other words of advice for nurse practitioners that are interested in this work and becoming a part of our world?
I think joining ISHWISH, identifying a mentor, if you can, who's close by, who's willing to teach. If you can't find a mentor who's close by to where you live or where you practice, I think my experience through, interacting with leaders in ISWISH, they're so excited that you're there and they want to teach. So if you can't find someone close to you, then cold call, send a LinkedIn message to someone who's doing this and just say, hey, listen, I'm kind of at the start here. I'm interested in learning more, or I'm interested in doing XYZ in my clinic. I'm interested in, changing how I ask, my patient history, or I'm interested in starting to do my exam differently. Can you guide me here? I think you might be surprised. I know it's really hard to take that first step and message someone that you don't know. But this community, I think, is really, again, unique in that it's so interdisciplinary, and so many of the folks who are, heavily involved with ISWISH are so passionate about education and advocacy. Send a cold, make a cold call, send a cold email to someone so that you have someone who's done it, who's, been there and done it already, and that you're not starting from square one. You're going to be surprised, I think, how welcoming that this community is. And yeah, I think, I can't speak for everybody, but anyone who voices interest in learning more, I feel like immediately very protective, and I'm so excited that they're there, and I'll do anything I can to help. So
Yeah,
that would be my other advice, I guess.
there's this that like nurses, they're young, right? And I can say that I never experienced that. And I started working directly into this subspecialty, so working directly in urology, urogynecology, sexual medicine, and it's always been welcoming. People have always been like, "Oh, you're interested in that? Nobody wants to see that, so let me pour into you as much as I can, so it can take some of the pressure off of me." That's what I've kind of found.
Yeah.
So if you are looking for a discipline where we're not going to eat our young, we want you to join us, we want to teach you, we want to bring you in, then sexual medicine is for you for sure. And I have started a Facebook group for clinicians. So it's interdisciplinary. It's called Tame the Taboo Clinicians. So if you are on Facebook, it's pretty easy to find us. You just search Tame the Taboo Clinicians, and we can share information and stories and connect and network within that group. So that's definitely a resource for anyone who's listening who might be interested in joining our world. So,
Amazing.
yay. I think we will end it there. Thank you so much for joining us today, Emily. And
Thank you.
Yay. We will see you on the next episode. Have a good one.
Thank you so much.
Yes. Thank you for tuning in to this episode of Tame the Taboo. If you enjoyed it, don't forget to hit like, share, and subscribe. Send this to your girlfriend so they can join you on your journey as we transition to our healthiest, wealthiest, best selves. See you on the next episode.